Hi, I'm Joe Chili, weekday morning, 7 to 9 on Buffalo's oldie station, the Big Weck. With us today on the Big Weck's Buffalo on the Rise, we have Dr. Ronald Gefaller from SoftWave Buffalo. Doctor, how you doing?
Very good. Thank you for having me.
I'm glad to have you here today. To start off with, for those people that don't realize, can you give us an idea of what SoftWave is and how it differs from like shockwave or things like this?
Well, actually, they're all lumped together in the same umbrella of shockwave therapy. What makes SoftWave so much more special is that it doesn't hurt. When you're treating a person, when you have normal shockwave therapy, it hurts every spot that you're at. And with my device, I can use it diagnostically to go ahead and see exactly where the areas of pain are and actually areas of damage. It only reacts to inflammation, damage, scar tissue. All right, so I'm not treating everything. I'm only treating the areas that really need to get treated.
And, you know, I think sometimes we think that this is great for athletes, but it's great for seniors or the regular individuals too, right?
Certainly. It's being used by dozens of professional sports teams, but I think the main benefit is for people with arthritis. Okay, arthritis is a chronic degenerative inflammatory disease. It's really debilitating. You know, people with arthritic knees, shoulders, hands. What we can do with this is actually calm down the arthritis, get the blood circulation working again, and actually have that area heal up better than what it was before.
How soon do patients actually start noticing improvement?
That's the most amazing thing about this. About 90% of our patients feel a substantial change right away after the first trial treatment. They get either a change of mobility or a change in soreness and pain, or a lot of times both. Very few people don't get that change.
Do you give people an idea in advance, your patients, about generally how long it's going to take? Can you give them a short amount and then a long amount of time?
Sure. There's a range, and obviously everybody's different. Everybody has different problems, long duration, amount of damage. Age is a factor, your general health is a factor. But we've had patients, that are, in their 80s respond in 2 or 3 visits, and we've had patients that, just take a little bit longer. The company says the average for most people is about 8 to 10 visits for most orthopedic injuries, but we try to get things done a lot faster in the office. We use a stronger dose, and we basically try to go ahead and push the condition along faster. I don't want people in my office any more than they actually have to be.
Any side effects that people should worry about?
The FDA says it's negligible. I mean, you can get maybe a little bit of redness in the skin, maybe some soreness afterwards, but it's all a temporary thing.
What about the length of treatment? Now, are the results long-lasting, or do you have to come back for subsequent treatments?
Very few people do we have to do any kind of touch-up work. And usually those people are the ones that are involved in sports activities, or they have another injury and get themselves hurt. The vast majority of my patients, once you go through a course of care and things are calmed down and healed up, they stay the way they are. They don't go ahead and fall apart again. I have one patient from 6 years ago. She had a bone-and-bone knee. And it was going to go ahead and have knee surgery. We were able to go ahead, and she didn't want to have surgery because the after effects of surgery aren't always good. It's about 30% of the patients still have chronic pain, and it takes almost 2 years to go ahead and fully recover from that. So we did a course of 8 visits with her. We were able to go ahead and get her pain-free, get her up and walking, and we had to do one touch-up visit about a year afterwards. And this is 6 years ago. And I've seen her for other types of conditions, back-related conditions, and we haven't had to touch her knee in that length of time. It's been wonderful.
Now, if somebody knows what they did that specifically injured them, and if it's something that they do on a regular basis, do you tell them not to do it anymore? or is it, I mean,
it's like, Doc, it hurts when I do this. Don't do that anymore.
Don't do that. Yeah, exactly right. Yeah.
Well, normally what we try to go ahead and do, we try to get them in a situation where hopefully they do things better and smarter, safer than what they were doing before, and try to teach them how to condition themselves to not have this thing happen again. But once you get that area more under control, it's like fixing your car. I mean, you can drive it into another tree and wreck it again, okay? But if you're being a little smarter and conscientious, normally you can avoid all those injuries and really keep it down to a bare minimum or nothing, if you're safe.
When you're talking about patients, what kind of an age range are you talking about here?
I've been treating people anywhere between their early teens. I have a lot of gymnasts I work with, and my oldest patient now has been 93 years old. And actually, that one's interesting because he had an injury to one of his muscles in his rear end that's been there for 50 years. and we're able to go ahead and get that under control again.
A muscle in his rear end,
A
did you
muscle in
say?
his rear end, yes. He had a torn muscle, and he's been to all sorts of doctors over the course of all these years, and he was able to go ahead and recovery is about 95% better, he says.
You know, I have friends that are a pain in my backside that I could probably get treated for too. Is it safe?
Extremely safe. It is the safest thing you can go ahead and do. There's no side effects, there's no tissue damage, no injuries associated with this at all, okay? And actually the nice thing about it too is that you can treat areas that you normally can't touch with other types of therapies. It has a 6-inch penetration, okay? It goes that deep into your body, can has an effect on that. It actually goes right through the bone tissue, so you can infect inflammation inside the bones, you can infect muscle and tendon injuries that you normally wouldn't be able to reach with any type of therapy.
Okay, say for instance I came in for treatment, I'm a patient. What about downtime?
Well, that's the other really great thing about this. There is no downtime associated with this, okay? You don't have to go ahead and the day of treatment, we advise people to drink a lot more water and try to take it easy that day, okay? But after that, you can go back to your normal routine and work around whatever you want to go ahead and work around. You know, our athletes love it because they can go right back to doing what they're doing. Our older patients, they don't have to give things up. They can just keep on progressing further and do more. And that's the whole objective here, is to have them be able to do more and enjoy life more without having to have that injury get in the way.
All right, Dr. Gefaller, thank you very much. We appreciate it. For more information and answers to your questions, contact SoftWave Buffalo with offices in Williamsville and Orchard Park by calling 716-667-6800 or go to softwavebuffalo.com. Sponsorship and promotional consideration for the preceding segment was provided by SoftWave Buffalo. Don't forget to join all your favorite personalities, JP, Roger Christian, Bob B.O., and me, classic oldies from the 60s and 70s. We're right there in the Big Whack.